Welcome to this online seminar on trends in aviation, a post-COVID perspective. So first of all, let me briefly introduce to you our guest speaker, Mr. Ajesh Kurien. He graduated with tourism degree from our college, and it is proud that he is part of our rich alumni. As far as the aviation industry, I mean tourism aviation is concerned, I think the willingness of the air travelers during this hard time remains an important question, whether they are willing to travel as far as tourism aviation is concerned. The pace of revival of the industry post COVID-19 pandemic will therefore depend entirely on the confidence building measures by the stakeholders and also the adaptability of the air travelers to this new normal. So it seems I personally feel a lot of effort we have to take before we take to the skies again. So to begin with this program, let me call Professor Shelji Matthew, convener of the program, for official welcome.
Department of Tourism, Pazhassiraja College, Pulpally, organizing a one-day national webinar on the trends in aviation, a post-COVID perspective. I deem it a pleasure to welcome the distinguished participants who are joined from different parts of the globe. I extend a warm welcome to our dynamic principal, Dr. Anil Kumar, who inaugurates this webinar. With immense pleasure, I extend a warm welcome to our eminent chief guest, Mr. Ajesh Kurien, Senior Trainer, National Aviation Services, Kuwait International Airport, who is magnanimous enough to furnish the keynote address on this session. Hearty welcome you, sir. I have the great pleasure to welcome our vibrant Vice Principal and IQAC Coordinator, Dr. Dilip M.R., who is introducing the topic of this conference. I extend our hearty welcome to our CEO, Reverend Father Varghese Kollavadi, who is facilitating on this function. Also, I extend our sincere welcome to our Bursar, George Alimutal, who is facilitating on this function. I extend esteemed welcome to my beloved colleague, Mr. Sanu Kumar PV, who is moderator of this session. Welcome, sir. I delighted to welcome all the eminent scholars and the students who have gathered here. Once again, I welcome to you all. Thank you.
Thank you, sir. Now we invite our Honorable Principal, Dr. Anil Kumar, to inaugurate the function.
Good morning, all of you. Most respected CEO of our college, Father Varghese Kollavadi, and Bursar, Father George Alimutal, the distinguished chief guest of today's webinar, Sri Ajesh Kurien, respected teachers from various departments, head of the Department of Travel and Tourism, Shelji Matthew, Dr. Dilip M.R., Sri Sanu Kumar, other heads of department, teachers of our college, dear participants, friends. It gives me pleasure to inaugurate this function because today's webinar is going to be handled by Sri Ajesh Kurien, who is an alumni of this college. And we are very proud that he is now the senior trainer, Kuwait International Airport in the aviation sector. And the topic of discussion is trends in aviation in the post-COVID perspective. I'm not going much in detail about this topic because the others have mentioned all those aspects, but still, all of us know that this in this COVID scenario or COVID pandemic has vastly affected most of the sectors where travel and tourism industry is one of the major industries which is affected very vastly because the travel, the hotel industry, everywhere we can see a very big fall in the business. And we have to overcome the situation by suggesting suitable measures because tourism is one of the world's largest industries. I'm not adding much, and this is time for discussions and presentation. I wish all success to the seminar, and I also declare the seminar open. Thank you.
Good morning to everyone. It's been my immense pleasure to be in part of this particular session, a seminar session with you all. And I'm glad and honored to be a part of alumni of Pazhassiraja College. My allotted topic is Trends in Aviation, a post-COVID perspective. As we all know, as our beloved source have been explained how COVID-19 has been had a significant dramatic tragical issues with the aviation and the tourism. And I'm going to present in perspective of an aviation professional. So the topics I'm going to handle are impact of COVID-19 pandemic in the aviation industry. We are going to discuss a little bit more about the impact of COVID-19 in the aviation industry and the role of aviation professionals during COVID-19. So what is our role? What the airlines are doing now? What the community, the aviation community is doing to contain these issues, to contain the virus, etc. And lastly, the best practices. What should be the practices across the globe, the aviation professionals to follow to mitigate the impact of COVID-19. So these three are the subjects I'm going to talk about. Let me go to the first part of it, that is impact of COVID-19 pandemic in the aviation industry. The impact on the global business, yes, apart from tourism industry, every industry has been affected because of COVID-19. COVID-19 has a dramatic impact on the world markets as it crashed most of the stock markets. Everybody knows about it. Workforce impact, yes, that is the main tragic issue happened in the world because of this COVID-19. The workforce impact, employees are asked to work from home, yes. But from March onwards, in most of the aviation professionals and across the globe, or not only the aviation professionals, but also the other professionals also, most of them are working from home. And if I'm talking about myself, I was working from my home since June until June. And from June onwards, the office have been opened and only 20% of the workforce have been allowed to enter to the office. So there was a rotation. In a week, I have to go at least 1 or 2 days to the office, and the office have sent the vehicle to me, and I can board only to the allocated vehicle to the office, and I can commute and to the office and then come back to my accommodation. So that was the working style during that time. Now, by August 30, I think the Kuwait government is going to take off all the curfews, and then we are going to start a normal life after 6 months. Spike in video conferencing usage, yes, of course. Right now we are using the same. For this seminar, we are using video conferencing, and many applications across the globe is pioneering those. We are using Zoom. At the office, I'm using Teams. In a different platform, we are using Skype for business. All those kind of video conferencing spikes has been increased, and it has been spiked. And everyone is accustomed to do that. Yes, budget cuts for companies, organizations, and governments. Budget cuts that includes the employee layoff. That is the most catastrophic issue here. Many people had been affected because of this. One of my friend who is working with Emirates Airline in Dubai, he was saying that out of 2,500 pilots, they have laid off almost 1,200 pilots. That means they cut half of the strength of the pilots. See, think about the people who lost their jobs, and the situation is going worse than any time in the world. Less employees and workers required. Yes, the business is not there, so the employees not required, the workers are not required. They are forcefully given with the unpaid leave, and they are going back to their home country. And there are people who has gone to their home country and who couldn't able to come back to the country. Visa expiries, all those kind of stuffs are going on, and confusions are around the globe, especially in the Middle East. Airlines report 96% drop in air travel as the pandemic continues. Yes, everyone knows that the travel industry has been affected very badly, and even the domestic sectors, international sectors, even though the flights are operating, the load factor is less than 10%. And people are very, very afraid to travel because of the quarantine. Quarantine in the sense, if I'm traveling from Kuwait, if I reach India, I have to be in my home quarantine or institutional quarantine for 14 days, minimum 14 days. So my 14 days of leave have been gone. Then while I'm coming back to Kuwait again, I have to go for PCR test, and then I have to go for again here quarantine. That is not home quarantine, institutional quarantine. I have to go, I have to pay for that. All those kind of confusions, people won't travel. So the quarantine becomes an irony for people. It is very difficult for people to go ahead with it. Air passenger volume has been plunged into a stream. You can see that source from IATA Economics, IATA Monthly Statistics. You can see a graph over here. In 2016, it reached out to 550 billion per month. So revenue passenger per kilometer, RPK, refers to the revenue passenger kilometers, was almost 550 in 2016. 2019, if it is seasonally adjusted, it is also coming under almost 700 billion per month, has been abruptly gone down to 50 billion, and it reached up to 4%, 5%. And the trend is towards, if you see a spike over here, a trend is in June, slightly it is increasing. If you see here, you can see it is slightly increasing, and the airline started now, say for example, in Kuwait, I can see that until June 31st, there was no much, until June 30, there was no much traffic in Kuwait International Airport. The airport was closed for many days, and all of a sudden, the repatriation flights have been started to take the nationals to the country, and then the other nationalities to their country, and they cannot able to come back. All those kind of stuff were there. Only very little flights were there, but now the passenger flights slowly started, but with less volume, less passengers on board. Governments around the world have introduced below restrictions to contain the virus. So what all are the restrictions? There are border closures, curfews. In Kuwait, curfew was there, 24 hours curfew was there during the initial phase of Corona. So we couldn't able to come out of our house. So we were calling someone to give, there was a hotline to call for to get the essentials for my home. So we were calling them, and they are getting the essentials to my home. We were not able to go out of the home during that time. But later on, the curfews have been slashed down, and then only 12 hours, then after 9 hours, now it is again continuing from night 9 until morning 5 o'clock. Airport closures, yeah, international borders have been closed, especially the airport borders. Airport has been closed, and also the movement of the people was zero, but there were airports who were handled with the essentials. The cargo flights were operating with the medical supplies and all. Quarantines, that is the most worst part of quarantine was the most worst part of COVID-19, the after effect of COVID-19. People are hesitant to travel because of this issue. Cities are locked down. Many cities are locked down. We cannot go enter into the city. You cannot come out of the city, all those kind of stuff. Everybody knows about it. And even our place is also going through this miserable condition. The travel industry has been greatly affected by airline cutting flights, cancellation of business trips, and tourists canceling holidays. We all are in the industry of travel and tourism, and we all know how badly affected, how COVID has been affected our industry very badly, and we don't know when it is going to have an end. But let's be positive, and all these situations will change. Countries are continuing to implement additional health measures at the airports and seaports, border crossings to contain the virus. So temperature checks prior to, what all are those conditions? Temperature checks prior to boarding planes and upon landing. Stringent questions about itineraries. People are asked for stringent questions, and they are getting stranded at the airport for a long hours to have the tests. Allow additional time to complete check-in formalities. So for example, if a passenger is traveling from some place to another place, the normal check-in time has been increased drastically because he has to go towards some kind of questioning. He has to fill up some declarations, and then only the authority will allow him to travel, go through the stringent medical checkups. Also the medical declarations. Now, let's go to the next subject with regard to the role of aviation professionals during COVID-19. Yes, I'm talking this particular topic in point of view of a person who is actively involved in the ground handling business. Active ground handling business in the sense, we are handling many airlines, European carriers, Middle East, American carriers, all those kind of airlines we are handling. And am I audible to everyone?
Yeah, it's audible.
Yes,
clear.
audible, sir.
Voice is clear. Yeah.
Voice is clear. Okay, fine.
You have to mute somebody has opened the mute. Please mute it. Unmute.
Probably, no problem. I thought that there are some questions. So, I think the questions can be raised in the Q&A session at the end. Okay, so let me go through. So, the role of aviation professionals in mitigating the impact. IATA and its members continue to support governments in their efforts to contain the spread of COVID-19. As we all know, WHO, IATA, ICAO, ILO, IMF, all these institutions, all these organizations across the globe are very keen in assisting the industries across the globe. And IATA, for us, as a ground handler, we are directly dependent to IATA, and we are directly following the IATA regulations and rules with regard to this. And they are providing information on time, and we are following the same. Since the crisis began, air cargo has been a vital partner in the transportation. Yes, air cargo, that never stopped. Every country is shipping the cargo through air or by ship or any other transport mode, which include food supplies, medicines and medical supplies, personal protective equipment, which includes a lot of surgical PPEs, medical equipments, pharmaceuticals, etc. Many airlines, passenger airlines, that is change occurred during this time. Many passenger airlines transformed their aircraft into cargo flights. So seats were used to carry cargo. You know, instead of passengers, cargo was settled on the seats and secured while assisting the passengers or assisting the people across the globe to support with the medical equipment and supplies. Emirates and Qatar Airways was the key airlines who were having the wide-bodied aircrafts. With those wide-bodied aircrafts, they transported tons of cargo, not only using the overload compartment of the aircraft, but also the passenger cabin. And it is amazing that I have been on one flight to see how they have been done these arrangements. I was invited by one of my colleague in Kuwait International Airport. So I went there and I saw personally that how they have been stacked the cargo on the passenger seats to support. And also that is another point of view, the revenue point of view. The airline is making revenue out of it. If passenger is not there, they can use their seats in order to ship the cargo. I am belonging to company National Aviation Services. National Aviation Services is the fastest growing aviation services provider in emerging market. From our initial operations in Kuwait, 2003, it's been years now. It's almost 17 years now. NAS have been set up. We transformed into a leading airport service provider with the presence across regions that includes Middle East, headquartered in Kuwait. We have branches in Abu Dhabi. We have branches in India also. Goa we are operating. In Ahmedabad we are operating. In Nagpur we are operating. We have stations over there, and you can see these all are our network. Okay, we are moving ahead with the best practices in aviation to mitigate the impact of COVID-19. What all are the best practices we can go ahead with? New airline safety measures against COVID-19 include extra cabin cleaning procedures. Yes, the aircraft cabin has to be cleaned in coordination with ICAO guidelines, in conjunction with the state regulatory requirements. The aircrafts have to be sterilized. The airplane has to be disinfected properly. Most of the aircrafts, almost all aircrafts, even if it is a Boeing or an Airbus, the aircrafts are fitted with HEPA filters. The HEPA filters are the high filtering systems, and also aircraft with high fogging. Health and safety practices for customers and employees. While we are at work, we have to be very clear about the health and safety practices, and that includes extra cabin cleaning procedures, that is airplane disinfection, aircraft fogging, sterilization, and also packaged meals. Inside the aircraft, the crew are not provided with the a la carte. They are providing with packaged meals and no printed reading materials in order to avoid the transmission. The in-flight magazines is no more available on board nowadays. Check-in with social distancing, protective check-in barriers. You know, the customer service have been changed. The principles of customer service have been changed drastically. Before, you have to smile towards the passenger, you have to talk to the face of the passenger, you have to lean towards the passenger. All these are the principles of customer service. Now, everything has been changed. You cannot see the smile of a person because he's already with the masks. So people are accustomed to these kind of changes. So recommendations for crew and ground staff. So what all are the recommendations for crew and the ground staff during this pandemic? Take precautionary measures to reduce the possibility of infection. So what could be the precautionary measures? Avoid rush hours, use private transport when possible to minimize contact with others. It lies in a person, so he has to take care of himself. the safety of himself and safety of the people around him. Minimize time spent in public areas, apply social distancing. We have to minimize the spend. If in case of exigency, we can go to a place, but please don't stand there for a prolonged time. And while we are waiting there, apply the social distancing. Wash hands frequently, avoid touching your eyes, nose, and mouth and with uncleaned hands. All these information you already know, no need of explanation. If you develop a fever, cough, or have difficulty breathing, immediately isolate yourself and report the situation to your employer or medical center. So isolation is everybody's responsibility if you're having symptoms of COVID-19. If you have COVID-19 symptoms during a flight, very importantly, discontinue your duties as soon as it is safe. Inform other crew members and follow the required measures. If you are an employee, while you are working on board as a cabin crew or a pilot, he has to discontinue the duties. As prescribed in the International Civil Aviation Organization, ICAO SAPS, the standards and operating procedures, says that some universal precaution kits should be there in the aircraft. That includes face and eye mask, separate goggles and medical mask or combined face shield for the crew members must be there on board. This is ICAO regulation. Germicidal disinfectants, wipes for surface cleaning, dry powder that can convert small liquid spills into a sterile granulated gel, full-length long-sleeved gown to be used, disposable gloves to be used, protective aprons to be used on board, and biohazard disposable waste bag. Yes, the disposal of this waste is also another important thing. So how you're going to dispose it? So it should be disposed in a properly well-defined manner. Coming to the standard precautions at workplace, this is actually mandated by ICAO, so it is better to read it out. As per ICAO, if a traveler develops symptoms of acute respiratory infection or shows signs or symptoms compatible with communicable diseases, including COVID-19 as documented in the Aircraft General Declaration, the IHR Annex 8, ICAO Annex 9, Appendix 1, efforts should be made to minimize contact of passengers and cabin crew with the ill person. So it is a mandate, it's a rule, it's a law that every airline has to make necessary measures to minimize the contact of passengers and cabin crew. The term minimize is very relevant here because the passenger have to be on board, the crew has to be on board, but they have to minimize the contacts. The ground handling recommendations include if a passenger reports with specific symptoms of fever, gives a history of feeling feverish, or has an actual measured temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher that has persisted for more than 48 hours. So if the passenger at any contact point at the check-in, at the boarding gate, or at the aircraft, if he have any history of all these symptoms, fever and one of the following, persistent cough, difficulty breathing, appears obviously unwell. In this case, there is no other alternative. Contact the manager or the ground-based medical service center. So this is a necessary instruction to every employees who are working in every contact point that is like check-in, boarding, and at the aircraft side. So if a passenger with communicable disease is reported on board, what are the cabin crew's precautionary measures? So this is also as per WHO and as per IATA. If a person is, a communicable disease is suspected when a traveler, passenger, or a crew member has a fever, temperature 38 degrees Celsius or greater. So if the passenger is having a constant headache, confusion of recent onset, bruising or bleeding without previous injury, skin rash, persistent cough, impaired breathing, persistent diarrhea, persistent vomiting, all these kind of symptoms. If a passenger is having on board, the crew has to go for an emergency, and they have to notify the captain. And also, if there is an emergency, there should be an emergency procedure have to be taken place, and the aircraft has to be landed on emergency, and also related to the severity of the situation. Depends, that is a crew member or the captain has his own procedures for emergency. As per WHO, crew and ground handling personnel should be further reminded about measures to prevent transmission of COVID-19, including social distancing of 2 meters minimum, hand hygiene have to be maintained, respiratory etiquette, while you are coughing or sneezing, cover your cough or sneeze. Then environmental cleaning, the cleaning is vital. Then coming to waste disposal, another important aspect. Use of masks, very important. In public places, every country is mandating to use masks correctly and avoid contact with infected person. So avoid maximum. The healthcare workers cannot avoid these kind of situations, but they have to use their PPEs accordingly. But for us, we can avoid contact, so we have to take care of ourselves and the community around us. And if we are having any symptoms of COVID, seek medical advice. That is the only possible way. What do you do if a passenger appears unwell? Suddenly a passenger at your check-in desk or at the aircraft or at the boarding gate appears unwell. What to do? If there is any doubt regarding the health of the passenger, the agent has to inform the supervisor, and then they have to go as per these procedures. The passenger has to be denied boarding. He is no more going on board. He has to be denied until a medical examination and clearance is performed by physician, and it is the customer airline's decision to accept or refuse the passenger. What do you do if a passenger feels unwell? Be polite and stay calm, take the required precautions, call your supervisor. Supervisors agree with your concerns. Yes, of course, he has to agree with our concerns. If there is any doubt, yes, contact the medical department, and then medical department isn't available, deny the boarding. Ask the passenger to obtain medical clearance as per the airline's policy and involve customer complaints section. So these all are the procedures a person have to taken care of if a passenger appears unwell at any contact point. At the airport, regular sanitation of high contact surfaces are required. That includes check-in counters, elevators, stairs, railings, trays, the trolleys, handles, and the baggage belts. So these are the guidelines provided by ICAO, and every airports have to abide these instructions, and they have to take care of it. So check-in measures. Every airport employees have to wear the PPEs. That includes a face shield or face mask, and also the gloves, except safety visor, and then mask and gloves. And standard displays instruction signs to be there at the airport. And boarding pace, the normal boarding speed has to be reduced, and there should be a social distancing in between. And the boarding pass at the gate, airport gate, has to be scanned by the passenger, because the boarding pass is a highly transmission. It's a solution for it's a source of transmission for the COVID-19, a boarding pass, because the passenger is handling this boarding pass every time. So it has to be scanned by the passengers. And the bus transfers also to be very careful. From a terminal to the aircraft, the transfers are using by the buses. If they are using the buses, they have to be very careful, and buses have to be disinfected. In-flight measures, many airlines blocking of all middle seats on wide body aircrafts and aisle seats on narrow body aircrafts. All food items individually wrapped and served on board. in-flight shopping has been suspended. Yes, everybody knows that the duty-free was on board. Almost all the airlines are using, getting revenue out of it now. They have stopped it because it's a source of infection, the high contact area. Onboard service have been reduced in all cabins in order to limit possible contact by hand, and it has been changed to the packaged meals. In-flight measures, airlines have imposed the below in-flight restrictions: no pillows, blankets. Yes, during the travel for a long-haul journey, the airlines are provided with these kind of amenities like pillows, blankets, all those kind of stuff, and no more. I mean, passengers have to carry by themselves, and no refreshing towels. Disposable, either disposable or cloth, they are not providing. No collection to the disposable headphones. Many of the full service carriers are having the in-flight entertainment system, IFE systems on board, and they are not provided with the collection of headphones. That means IFE systems will not work in certain sectors and in particularly in certain classes. Sanitizing soaps are available in the washrooms. Yeah, that's also another precaution. We will go towards the end of this particular slideshow. The crisis is beginning. The crisis is in process and not in the beginning stage. It's in the worst stage now, and also we don't know when it will be get contained. The disease is spreading all across the globe, and people are living with the virus nowadays, and hope is in the air. We have to have our full belief in the aviation industry and the tourism industry. This pandemic will definitely will come to an end. The only thing is we have to keep the confidence level of the travelers, the tourists, the people who are going around after vacation, the going for vacation, all those kind of stuff has to be reinstated, and the status quo has to be maintained.